Folks have gone several weeks without showers or without access to the outside world, without being able to actually get any fresh air. Folks have raised concern in places like Central East about poor water conditions or the quality of water. And all of this is happening along the backdrop of like a steady increase in funding for prisons under all governments.
Prisoners' rights advocates expressed their dismay after Conservative Party leader Erin O'Toole tweets that he doesn't think that criminals should get a COVID-19 vaccine before other vulnerable Canadians or essential frontline healthcare workers. But advocates for those in Canadian prisons say this doesn't just ignore current prison outbreaks, but also the reality of who's in Canada's prisons.
Provincially, we know that about 2/3 of folks that are being held in provincial institutions have never been actually convicted of a crime. They've never been sentenced. They're awaiting trial. And so this idea that our facilities are filled with people who have committed kind of horrific, violent crimes is itself a fiction.
The Toronto Prisoners' Rights Project says outbreaks happening now are the inevitable result of existing problems. They say overcrowding and poor sanitary conditions are common and add that it's clearly enshrined in law that governments must provide the same standard of health care to those in prisons as those outside. Defense attorney Alison Craig says vaccinating inmates isn't just about responsibility, it's good public health.
We've had a lot of in-court proceedings this year since COVID hit, epidemiological evidence that talks about the fact that when there's an outbreak in a prison, it puts the surrounding community in grave danger as well, because it overwhelms the local hospital and the local community, and then the problems just compound upon each other and spread even more widely. So not only is it frankly ignorant to suggest that inmates and prisoners have any less right to health care as the rest of the community, but it also ignores the broader implications of a COVID outbreak in a jail.
Corrections officers themselves say they're in the dark about when they'll get the vaccine. The union representing corrections officers says the correctional service has told them there will be 1,200 doses administered to elderly inmates, but they're not sure when their own members will get the shot or if prisons experiencing outbreaks will be prioritized.
We have many sites across the country that have now been designated as pandemic sites. And, our members are going there every single day and having to intervene and sometimes with potentially infected individuals. This is a level of protection that needs to be provided for our members.
We have a duty of care for those who are in our custody to ensure that they are treated fairly and that they are kept safe. And I think that's also very much in the interest of those correction workers who are in those institutions, that we take the steps necessary to protect the most vulnerable people in those institutions.
Now, Jeff Wilkins, the head of the union representing correctional service officers, says he's been told that the pilot to vaccinate prisoners will start this Friday. But he adds that the pilot is slated to only vaccinate 10 of the highest risk inmates at each facility, with no indication yet as to what's to be done with the remaining doses or when more vaccine doses would arrive. In Ottawa, Xiaoli Li, City News.